Do you believe that if patients do not accept the dentistry they need because of money?
When a patient hears a treatment plan and you've educated them, you made them part of the decision, most will accept, I'll call it covered work. But now you need to determine, they have to work on figuring out how they're going to buy and pay for this. So we use different lending programs and we talk monthly costs, but there's still a large part of the population out there that has significant economic challenges. So everyone's not a millionaire. It always comes back to, trust. If the patient trusts you and the treatment is proper and they believe in you, and the team can do the work properly, that works out well. But bottom line, the patients that don't accept treatment, once you've had all those other things firing, that's all about money. And absolutely, patients not accepting treatment is either they don't trust you or they just can't afford it. And our patient population, you get, basically it's an issue of affording, because we do use our patients as, part of the process, where they're going and the educational process for them. So, but more people are economically challenged right now, especially with what we're going through globally. So I think we're going to see more and more of this resistance for advanced care, because patients don't have the free spendable dollars.
Thank you. And Carolina, what do you think about that question? So do the majority of patients not accept dentistry because of money?
I talk about that a lot in the first book that you mentioned before, in Show Me Your Teeth, and explain to patients how to deal with this. It is true that the way the patient thinks is, when I have the money, when I get the money, I will do this. And they're expecting a death in the family and inheritance, or they're expecting Lotto, or they're expecting a raise. And I keep telling them, understand that that's not how it works in dentistry. Within 2 years, your treatment could become 40% more expensive, not because we raise the prices, but because it becomes so much more complicated to treat what you have. So if we're talking the implants, and right now you have bone and no money, in 2 years, you might have money and no bone. If you have no bone in 2 years, we need to do grafting. You're talking about $10,000 more. You're talking about 6 more months of treatment. So we have to make the patient understand that sometimes paying a bank loan, even at 10%, because it's a personal bank loan, paying a bank loan at 10% is much cheaper than waiting 3 years and having a 30 or 40% increase in the cost of your treatment because you waited. A tooth that requires a filling now will be a root canal, a post, and a crown in 3 years, if it can be saved. And that goes from $250 eventually in a high-end practice to $2,500 or more. So we have to educate patients at that level. They can get loans with their banks. If their relationship is not good with their banks, we have a good relationship with our bank. We always do, because we put money in the bank. So we can have our bank sit down with our bank, the dental office bank, and we can sit down with them and say, I want you to make it easy for my patients to get a loan through you. You will make money. What happens there, and it worked wonderfully for us. And we had, when I sold my practice, we had, I would say, more than 50% of middle to low class patients, because they wanted something different. They were fed up with having their mouths destroyed, their teeth destroyed. And we went to the bank and said, listen, the treatments we're doing are 2 years long. If you do a loan in 3 years or 4 years, somehow the patient, because they went to your bank, they link the loan to the treatment. They feel like they have to pay the bank more than with their own bank, because it's your bank. And I've never seen in the years that, seriously, I've never seen in the years that I've practiced and used my own bank to finance my patients, I have never seen an unpaid loan, never. So it does work. So it's not only about them and their banks. They don't know how to deal with a bank. We know how to deal with a bank, even if we don't have an MBA. So I do believe that the understanding and trust has to increase. The acceptance will increase immediately. And the key issue is the patient accepting the doctor and trusting that we will do everything in our power for them to be able to afford the treatment. I'm not making the treatment cheap. I'm making it affordable for them. And I made treatments at the end. I knew how to make treatments affordable, keeping the high quality and keeping the standard that I wanted to work with.